Deciding which healthcare program to choose can be stressful and overwhelming. It is important to get all the information that you can to make the right choice for you and your family. In today's Angie's List report, why it pays to be proactive when choosing your health plan. Changes in healthcare have put us in the driver's seat. Now is the time to do your research, weigh all options, and pick a health plan that's right for you.
Taking advantage of the open enrollment period is a time for you to evaluate what your insurance covers and make sure you assess what needs you're going to have over the next year. So if you need to make changes to your insurance, you can do it now before it's too late.
When Charlie Klump turned 65, she learned her physician's practice didn't accept Medicare. After paying for a couple of office visits out of pocket, Klump decided to switch doctors. Now, she always checks with doctors before scheduling an appointment.
I called, talked to the business office and said, now, I am a Medicare patient. That's my primary. I have a secondary insurance. But will you file that for me? Do you have any concerns about taking on an additional Medicare patient?
One thing many people overlook is whether their doctor is going to continue to accept their insurance. So while you're evaluating insurance, be sure you have a conversation with your doctor, especially if you're in the midst of a longer-term treatment plan, to be sure that you're still going to be covered. Because the last thing you want to have to do is change your doctor in the middle of treatment because of an insurance issue.
If you don't understand what your plan does and does not cover, you could end up spending more money. Don't assume the plan and policy you had last year will still cover your needs this year.
The biggest mistake people generally make when they're buying insurance is not knowing what they're looking for. People know they need it, and now they have to get it per the new laws, but they don't have an idea of exactly what they're looking for, and often when they purchase it, they don't understand what they have.
Take a look at what you spent last year in premiums and out-of-pocket expenses and compare that to what you expect to spend in 2014. If you don't understand your healthcare options, don't be afraid to ask questions. Sit down with your benefits person at work or talk with a financial planner or insurance broker.
We can shop every single insurance company licensed to do business in your state. We can, recommend plans and give you pros and cons of each. And brokers are paid actually and compensated by the insurance companies themselves. So there's no fees or service charge to work with a broker. And we can just make the whole process a lot more smoother, more efficient, and just, make the whole process a lot easier on you.
Angie's List says if you decide to work with an insurance broker who's an independent agent, you'll want to make sure he or she has the necessary credentials and is appropriately licensed. Requirements vary in each state, but generally insurance agents must pass an exam to become licensed and certified. I'm Noah Began for News 46.